So today we're going to talk about nosebleeds. We have that old adage, oh, it's just a nosebleed. But nosebleeds can be aggravating and they can also be, in certain cases, life-threatening. So the nose has a really good blood supply, and it does because we want the nose to warm and humidify air on the way to the lungs. It also has great functions in terms of filtration and smell that are super important to us. And so the blood supply to the nose is well known to be fantastic. Problem is, if you get a nick in an artery or a capillary, it can result in significant nosebleed, which can be quite aggravating. Nosebleeds are very common in kids. Sometimes they pick their nose, sometimes it's just because, and they get nosebleeds that can be aggravating at school. You get a call from the school nurse, hey, you need to pick up your child because they've had a severe nosebleed, and that can be disruptive to parenting, obviously. So the easiest treatment for nosebleed is conservative therapy. Humidifier in your room at night, a bacitracin or other petroleum product for 2 weeks only into the nose on a Q-tip. Now, one of the things that people do is to just put a little touch on. You really want to get a big gob of that stuff. You want to put it in to about 1 to 1.5 times the length of the Q-tip and roll it around the inside. Pinch off the excess so that it flattens out, and that moisture allows those cells to crawl over each other and heal that area. For nosebleeds that don't respond to conservative therapy, sometimes they need to be cauterized. There are two major vessels that supply the nasal septum, which is the wall that separates your nose into left and right halves. That's the most common place to have a nosebleed. The anterior Kieselbach's plexus, which is a fancy name for the front of the nose and the artery that supplies it, and then the posterior circulation, that just means front and back. Obviously, the front ones are much easier to take care of. Silver nitrate can be used when applied to a blood vessel. It's very easy to anesthetize the front part of the nose in the office and to apply the silver nitrate in order to have the blood vessel call all of its platelet friends and make a nice thrombus or a clot that prevents it from bleeding again. So you're really creating an injury with the silver nitrate that creates a clot. Post-operatively or after cauterization, you want to be able to care for that. So saline spray, humidification in your room. You want to go ahead and use Vaseline or bacitracin. I would avoid Neosporin because 20% of people have a reaction to the neomycin in Neosporin. And you want a pretty good gob of it, and you want to put that on a Q-tip, put it in the nostril, and roll it around, pinch off the excess to spread out the petroleum product over the area. You want to do that about 4 or 5 times a day, particularly in arid climates. So the saltwater spray, humidification, application of the petroleum product. You don't want to use the petroleum product for greater than 2 to 3 weeks because over time petroleum can enter the lungs and you can have a reaction against that foreign body. So you just want to use it temporarily until the area is healed. Sometimes nosebleeds can be quite severe and require electrocautery, which is where we use a device that has an electrical current to zap the blood vessel. That can be in the front or in the back. For very severe nosebleeds, usually caused by cardiac medications that thin the blood, excess use of non-steroidal anti-inflammatory medications, aspirin, and sometimes just bad luck and being in an arid climate, we have to get pretty serious about controlling the nosebleed. So there are packs that can be used to control the nosebleed, and obviously if we're controlling it back here, that's not a lot of fun to have the pack in the nostril and all the way back there. But most people that have this are on some kind of medication, generally age 55 or greater, and the posterior epistaxis usually is taken care of by the packing. For rare cases, we have to go to the interventional radiology suite and have embolization. That is where a catheter is placed in the femoral artery, which is right in the groin, and threaded up to the side that is bleeding, and coils or superglue are placed into the blood vessel to stop it from bleeding. Those are for severe, life-threatening bleeds that result in significant anemia. In summary, most nosebleeds are in the front of the nose and are fairly easy to control with conservative measures such as humidification, nasal saline spray, and a petroleum product in the front part of the nose, as we spoke about. For an acute nosebleed, you can use a nasal decongestant and pinch your nose for about 15 to 20 minutes, and that can take care of most nosebleeds as well. And they can then be treated with conservative measures. As we spoke about, nosebleeds can be severe. If there is a severe nosebleed where someone is losing a great amount of blood and can't be stopped, that obviously would require a trip to the emergency room and can sometimes require surgical management or interventional radiology.